Bismillah ar-Rahman ar-Rahim. My name is Musa Abumar Mohammed. Today I am excited to walk with you through our project, which is about integration of our systems into project life cycle. Our presentation is about Mogadishu Coastal Hospital Expansion Project, MCHX. The Mogadishu Coastal Hospital Expansion Project was initiated by the Ministry of Health to meet the increasing demand for specialized medical services in Mogadishu. The existing infrastructure is of a stringent leading to long waiting times and overcrowding. This ambitious program involves constructing a new six-story hospital wing with advanced surgical suites, a machinery complex, an intensive care unit, specialized laboratories, and additional inpatient wards. The project aim is to modernize service delivery, improve infection control, and meet international standards for patient safety. Comprehensive project scope is to the MCH project encompasses all activities to plan, design, construct, install, test, and commission fully operational six-story hospital wing. The scope is divided into several key areas. First, construction and structural works, reinforced concrete structure, fire-resistant materials, accessibility features. And second is to environmental and waste management, specialized medical waste facility, segregated storage, upgraded wastewater. And third is to operational integration and commissioning, system testing, staff training, compliance verification, and handover. And four is MEP systems advanced in HVAC, medical gas systems, electrical plumbing, fire detection. And the five is to external work and site development, landscaping and plus routaries, security and temporary access and zones. The last one is to project management and OSH. Project management plans, OSH management system, reporting coordination. Core business pillars of healthcare. The Mogadishu Coastal Hospital core business is to provide high quality, patient-centered healthcare. Its operational model is built on three fundamental pillars. First is to clinical service delivery. 24/7 operation is for diagnosis, treatment, and management of medical conditions, including emergency response, surgery, and critical care. The second is to public health responsibility, supporting initiatives like immunization programs, health education, disease surveillance, and responding to health emergencies. And the third one is to capacity building, serving, education, and training environment for medical students, nurses, and health professionals to develop the national healthcare workforce. Project plan, a 24-month journey. The MCH project is scheduled for 24 months, divided into five main planning phases, ensuring structured approaches for phase one is to initiation, which was month one and to up to 2 months. Feasibility study, goal definition, project charter, and approval stakeholders and funding. And the second phase is to plan and design, which up to 6 months, BMP development, architectural design and risk assessment, OSH plans, budgeting, contractor tendering. Phase three is to execution and construction, site preparation, structural work, and map installations, internal finishes, environmental measures, safety supervision. Phase four is to monitoring and control, which up to 24 months, month one up to 24 months. Progress tracking, OSH audits, risk management, quality control, monthly reporting, and change management. Phase five is to commission and closing. System testing, staff training, final inspection, compliance certificates, handover, lessons learned. OSH integration planning phase, integrating occupational safety, health, or environmental. OSH systems begins at the earliest planning stages. First is to OSH policy and frameworks, formal policy aligned with ISO and outlining the responsibilities and performance expectations. And the second is to hazard identification, risk assessment and control, comprehensive risk assessment for construction activities and environmental impact is documented in risk registers. OSH plans and documentations. development ocean management plan, environmental management plan, emergency response plan, and training plan. Design phase 4 is to design and safety environmental protection, incorporating safety into design such as edge protection, fire resistant materials, and sound barriers. And the first phase and the last phase, which is phase 5, is contractor pre-qualification, selecting contractors with proven safety performance and including mandatory OSH clauses in contractors. OSH integration is execution phase. The execution phase is critical for OSH, which daily explanation, with this application for the principles to prevent incidents, silence separate workers, and safeguard patient and minimize environmental impacts. Execution phase is about 5 phases. First phase is to site introduction and training, and the second phase is permit to work system, and the third phase is to daily toolbox talks. Fourth phase is to environmental and control measures, and the last phase is to safe work practices and PPE, which is mandatory PPE use, clear signage barrier, barricades, and adequate lighting. Washington monitoring and controlling is continuous monitoring ensures compliance with ocean standards and provides opportunities for ongoing improvements throughout regular inspection. First is regular inspection and audits. Daily insight inspection, weekly through walk throughout, monthly ocean and audits against the ISO standards. And the second is to performance metrics and indicators, tracking leading terrain inspection and lagging injury traces and accidents indicators. And the third is the environmental monitoring, air quality, noise levels, water quality, and waste handling inspection. And the fourth is to stakeholder communication, sharing regular OSH reports with communities, leadership contractors, and community. And the last is to corrective and preventive actions, CAPA, assigning and tracking corrective actions for all identified OSH issues, integrating lessons learned. Key challenges and hospital construction. The MCHX project faces unique challenges it is a complex nature, sensitive environment, and diverse stakeholders. First is functional hospital environment, managing noise, restricted access, dust, and strict infection control near active patient care areas. Second is to high risk construction activities. Tasks like walking at height, heavy lifting, electrical installation is confined spaces, and hazardous material handling. OSH awareness and workforce competency. Addressing gaps in safety training, environmental practices, subcontractor compliance, and resistance to new protocols. And the last one is to coordination with multiple stakeholders, managing expectations and priorities of the Ministry of Health, hospital staff, contractors, community, and regulators. Conclusion and recommendation. Integrating OSH systems is crucial for delivering safe, sustainable, and high-quality infrastructure for Mogadishu Coastal Hospital Expansion Project. A well-implemented OSH frameworks ensure the expanded hospital facility is delivered safely, responsibly, and ready to provide improved healthcare service to the population. Documentation is formalized. OSH system is adapted for safety, for environmental protection, to ensure structured risk control and continuous improvement. Strengthen safety leadership projects. Leaders must demonstrate feasible commitment through site work downs, safety meetings, and advocacy critical OSH decisions. Prioritize continuous training, implement regular training, refresher course, and specialized workshops for all workers and supervisors to enhance competence. And I would like to stop our presentation video. Thank you, everyone.